There is a renewed call for Medicaid expansion in the state of Wisconsin. In a press briefing in early June, our Governor Tony Evers said Medicaid expansion is one of the most important ways we can help address racial disparities in health outcomes in our state. It was a reflection of the tumultuous times we have in the state of Wisconsin. But Governor Evers has been calling for Medicaid expansion since before he was elected governor, and he keeps hitting roadblocks in our legislature. He cited in that press briefing some statistics that just point to how important Medicaid expansion could be at this time. He said Wisconsin has the worst racial disparities in the nation. Disproportionate impact of coronavirus in Wisconsin is hitting our Black community, and he cited statistics of 19% of COVID cases and 25% of deaths are in the Black community. That's far outpacing the proportion of Black individuals in our population generally. He continued to say racism has never really gone away. It has only manifested itself in different ways, from incarceration rates to health outcome disparities, a wage gap to housing, in transportation, and in education inequities. Now, Medicaid expansion, like we said, has been a fight in this state. It was stripped from the state budget by our Joint Finance Committee. Wisconsin GOP leaders have refused to consider a standalone Medicaid expansion bill beyond the state budget. We wonder at times if there might be cracks in that Republican opposition. We have an outgoing Senator, Luther Olson, who supported Medicaid expansion. He's on his way out as he is retiring from the Senate. Might be an opportunity to speak up and start supporting some of the low income, the disparity, and the vulnerable populations in our state. There is even a new Urban Institute report that estimates the benefits of accepting Medicaid expansion in each of the states that have yet to expand Medicaid. It says Wisconsin could reduce its uninsured population by about 16% by accepting federal Medicaid expansion funds, and that's not even taking the current COVID pandemic into account. Wisconsin's Department of Revenue has its own study from 2019 that said Wisconsin residents are actually paying more than $1 billion a year towards Medicaid expansion in other states. It suggests we might do well to recoup some of that money that we are paying in for our own Medicaid expansion. Of course, the feds pay 90% of Medicaid expansion. The state would then pay the remaining 10%. Back in early March, we posted a video called Wisconsin Must Do the Right Thing. We're renewing that call. We can promote racial and social justice and help many more people in our state, but legislature, its intransigence and ideology are causing this political inertia. They're just going to keep doing what they're doing, and we don't see any change in the near future. But time will tell. Times are changing. We have Medicaid expansion that was just passed by the voters in the state of Oklahoma. Missouri is going to be taking it up as a constitutional amendment in August. Wisconsin, we hope, could be not too far behind in changing its mind. We link to some descriptions below where some of these quotes were taken for, but we leave you with one last thought from Governor Evers. We must use this dark moment to begin to be an example for the rest of the nation. We must fix what we know is broken in our society. We must intentionally address and dismantle individual and systemic racism, discrimination, and bias. Medicaid expansion is one way to do that.